Hi, I'm David Liew, reporting for Room Now from Copenhagen, EULAR 2022. Another big Friday here at EULAR. Lose track of the time, but certainly there's a lot going on. It's been a really great meeting. I think one thing which really was a highlight for me today was actually one of the debates that happened today, structured, slightly comedic debate between Christian Diaco and Robert Landaway on the subject of telemedicine. That's a subject that I think unless you've gone on holiday for the last 2.5 years, you would have lived your lived experience every day probably sticks with you. And as we move out of this pandemic, we've got to try and figure out how we can do this better. We're no longer at the point where we're just trying to patch it through. We're actually trying to figure out what this means for our long-term future. And so that was the basis of this debate here. Christian Diaco was on the side, allocated a side that telemedicine is going to fix everything. Robert Landaway was on the side that telemedicine is going to ruin everything. And with some robust humor between the two, I think we worked through some of the issues. And Christian made some pretty important points about the efficiencies that plausibly could occur from telemedicine, enabling us to be able to service our patients better at a time when we're under greater and greater strain in terms of our capacity to serve the needs that we need to be able to follow up patients readily, to make diagnoses earlier, and to actually make the system better from that point of view. And that telemedicine might actually be what facilitates that. On the other hand, Robert Landaway made the very strong points about the fact that empathy and the processes around it are just so critical to the way that we interact with our patients, and more importantly, about our patients' outcomes, their happiness, and what actually happens in terms of what they experience about their disease. That empathy is such a big part of what we do, more than just drugs, empathy. And in fact, it's a lot easier to deliver that and all the components of it in person. Now, of course, these are two deliberately extreme sides of things. And the truth, of course, in reality, it lies in between. What I think both speakers agreed on in the discussion, they made it clear that despite the banter, they are definitely forever friends, is the idea that we need to try and find a way to harness telemedicine in the places where we can use it. And we'll get all the benefits of the flexibility for the patient and for the clinician, all the benefits that we can potentially get in terms of being able to facilitate better care. At the same time, not compromise the empathy and the in-person clinical care that we have held on to for centuries and which make our specialty really quite special. For plenty more about telemedicine, all the things going on in rheumatology and at EULAR 2022, head on down to Room Now.